This is FYI on your TV, brought to you by Hometown News. I'm Kathy Botham. I've got Dana Douglas back with me. It's been a long time.
It has been a few
It's
years.
been a long time. You are a registered dietitian, but you're a public health nutritionist with the Leeds, Grenville, and Lanark District Health Unit. Welcome back.
Thank you.
We are here to talk about food insecurities. Great timing, because we've got the Build a Mountain of Food that's been going through our area. We know people struggle all year round, but there's a lot of support out there right now too, with food banks and everything like that too. But it starts with you too, where we find out where the need is, for sure. So can we first start talking about what is the nutrition food basket costing?
So since 1998, the health unit has done the nutritious food basket costing. So what this is we go into several different grocery stores across Leeds, Grenville, and Lanark, and we look at the price of a list of different food items. And then we take the price of these food items and we calculate the average cost of a healthy diet for different age and gender groups. So from this average cost of a healthy diet, we can then compare it to different income and expense scenarios.
Okay. Now, so what is included with the costing then?
So the costing, it looks at many different food items that are part of Canada's food guide, and it is very well rounded. So we do look at fresh, frozen, and canned vegetables and fruit, several different protein foods, as well as whole grain foods.
And unfortunately, when we talk food insecurity, that's not what people are able to afford either. So it's hard when you try and do the healthy, what should be bought versus what people actually can afford. And that's what you're here to talk about today too, though. So
yes.
What are you looking to find in those results?
So as I mentioned, we take the average cost of a healthy diet for different age and gender groups, and we compare it to different income and expense scenarios. And the results show us that those in our community who are living with food insecurity, they struggle to be able to afford enough nutritious food to eat, like you mentioned. And this is after they have to pay for rent, bills, and other expenses.
That's right. Now, we've both said the words food insecurity. What is food insecurity?
So food insecurity, it's not having enough money to buy enough nutritious food. Food insecurity, it's an income issue. It's not a food issue. So when money is tight, there's often less money in the budget to buy food.
Okay, all right. So what are the findings from the nutritious food basket costing for this year?
So this year, we saw that the average cost of a healthy diet for a family of 4, for example, so a mom, dad, a boy, and girl, this average cost on a monthly basis was $1,130. So this is as of June of this year, and we know that prices have likely gone up since that point.
That's for a month?
Yes,
that's for a month. Okay.
Yes, yeah. So like I mentioned, we can take this cost and then compare it to different income and expense scenarios. So if we take, for example, a family of 4 who are receiving Ontario Works, this family might receive an income of about $2,800 a month. So after this family pays for rent, which for a 3-bedroom unit in our area is about $1,600, and this family pays for food, this family would have only $87 left for the whole month to pay for all other expenses.
So we're talking hydro, we're talking
exactly.
TV, everything,
yes,
your
exactly.
internet.
Childcare,
yes.
school supplies, any prescription medication. So in this scenario, you can see that food budgets are often sacrificed in order to pay for these other expenses. And food is often seen as a more negotiable expense compared to other expenses like rent or hydro that aren't negotiable.
And so often too, you see that families, the parents forego good nutrition to be able to feed their children.
Exactly.
That's right, that's right. So what are the effects of not being able to afford food?
So not having enough healthy food to eat, it doesn't allow us to get enough of the vitamins, minerals, and energy that we need to maintain good overall physical and mental health. So we know that we need a nutritious food intake to have healthy pregnancies and birth outcomes, healthy growth and development, and also to reduce the risk of chronic disease later in life. So food insecurity and not having enough healthy food to eat negatively impacts our health in many ways.
Absolutely. So what can be done to support those experiencing food insecurities?
We can support and enhance income tax filing initiatives that are targeted for low-income households. We can advocate for increases to social assistance and minimum wage rates so that they provide for the cost of living. And we can also encourage local businesses and organizations to become living wage employers and support those that are.
Okay, so can you talk more about minimum wage and the living wage, what that means for people?
I can. So minimum wage is legislated by the provincial government, and it's the minimum amount of money that employers must pay their worker per hour worked. A living wage, on the other hand, it reflects the amount of money that people actually need to make in order to be able to afford the cost of living in their community. So when employers become living wage employers and they commit to providing their employees with a living wage, it's important because it provides workers with a basic level of economic security.
Okay, so what is the living wage rate in our community, and what can people do?
So I'll start with the minimum wage rate.
Okay.
So that currently is $16.55 per hour. So the living wage, it was just released early November for our region for 2023, and it was calculated to be $20.60 per hour. So there's a discrepancy of about $4 an hour. In terms of what people can do, we can again advocate for increases to social assistance and minimum wage rates. And I stress this again because providing a living wage would allow people to be able to afford the cost of living in their community. So those rates do need to increase. Another option is for employers to become certified with the Ontario Living Wage Network. So this is when they would commit to providing their employees with, at minimum, a living wage. And if you visit ontariolivingwage.ca, it has much more information on that. I also encourage everyone to visit the Health Unit website. So it's at healthunit.org, and we have newly released our food insecurity infographic and report. And they have an abundance of information on food insecurity. And we also walk through several other income and expense scenarios, like the one that we talked about today. And it really breaks down what the situations look like for people that are experiencing those situations.
Yes, it's unfortunate, and people do struggle. And like we say, there's so often the parents forego, so to make sure their children are fed a nutritious meal and everything. There are resources for people too. We have food banks. Many schools have got those wonderful breakfast programs too, you know, and so often I hear about, you know, these lunches that service groups and churches have and everything like that. I've heard that parents go in there and they don't want food for themselves. They just want, can I grab a couple lunches for my kids and I'll take them over to the school. So there are resources out there too, so please reach out if you need help, and the Health Unit is one of them.
Exactly, and we do have a list on our website. We have a food inventory where we do list all of the current meal calendars and the food bank options in our area. So there is a wealth of information there on the website as well.
Excellent. So now when you're not doing this sort of thing, what is it you do at the Health Unit?
I do support our Healthy Growth and Development team, so I do quite a bit of work with young families, babies, and young children.
Excellent, excellent. So people need more information about that sort of thing, they get a hold of you?
For sure.
Excellent, excellent. So how do people get a hold of the Health Unit?
The best way is probably through our website. So we healthunit.org, as I mentioned. We also have a 1-800 number. It's 1-800-660-5853. And we are also active on Facebook and X.
Excellent, excellent. You've got a great website. I can get a hold of Sue Healy as our connection here all the time. She's always sending people from the Health Unit here so we can learn more about it too. So I thank you for taking time out today and talking to us about this very important issue to support people in our area. So thank you very much for everything you do.
Thank you for having me.
Once again, Dana Douglas from our Health Unit here in Smith Falls. No, I should say Leeds, Grenville, and Lanark District Health Unit. You have a big catchment area.
We do cover a lot.
That's right. Thank you very much.
Thank you.